Welcome Home, a podcast for veterans about veterans by veterans, is a project of Willing Warriors and the Warrior Retreat at Bull Run.
Good morning. I'm your host, Larry Ziliox, Director of Culinary Services here at the Warrior Retreat at Bull Run. And this week, I have two special guests, Dr. Maheen Adamson and Dr. Jennifer Jennings. They are both with the VA at the Women's Operational Military Exposure Network Center of Excellence. And so these are, honest to God, real doctors. This is not like your medic that you call doc. They have an extensive doctor background. I'm not going to go through it. It's really long. You can go to the webpage, which will be listed in the show notes, and read all about it. But I asked them to join us to talk about the center and the research that they're doing out there on military exposure for our women veterans. So Dr. Adamson and Dr. Jennings, welcome to the show.
Thank you. Thank you for having us on.
So
thank you very much. Thank you for having us on.
Yes. So Dr. Adamson, you are the research director, and let's see, Dr. Jennings, you are the clinical director. Dr. Adamson, could you tell our listeners what the difference is?
Absolutely. The number one difference is that I'm a PhD and she's an MD. And particularly, she is a neurosurgeon, and she is the best way to describe it for this Women's Operational Military Exposure Network Center of Excellence is that we are a team. So I do research based on what she tells me are the most salient problems and the most important problems that exist in our veterans. And so we constantly are aligned together so that my research feeds into her clinical work and her clinical work feeds into research. So she sees patients, women, veterans, and I do research on their problems. So that really is the main difference. And Jen, you want to add to that?
Yeah, I think you covered it quite well. I've been the clinical director of the California War-Related Illness and Injury Study Center, so I've been seeing men and women for a number of years now with unexplained military exposure-related illness. And when we got funding for some special centers, California was designated to work with women veterans in military environmental exposure. So we were fortunate enough to be able to develop that center and bring Dr. Adamson on as research director, as well as an amazing team. We have an epidemiologist, statistician, a number of PhDs. And so we're able to address a lot of the issues we had been seeing in our clinical program. Now being able to take that into some translational research, that's kind of how we came about.
So listeners, the network or the Center of Excellence, they focus on the health of women veterans who are exposed to military environmental hazards. So this is, your burn pits, your JP4 fuels, these spills like Red Hill. It could be any number of things, but what I like is that it's a center and it's research being done specifically to find out how these environmental hazards affect our women veterans differently than our men veterans, because as we all know, for so long, women veterans have been underserved. I'm sure for years, everybody just said, oh, well, I'm sure it affects them in the same way. Dr. Adamson, can you tell us a little bit about the research that you have going on now, like the number one program that you're looking into?
Sure. First of all, I wanted to thank you for your comments and bringing us on this show, because we are an underserved population, women overall, but women veterans are even more than that. And as you know, the representation of women in the military has increased from quite a bit. I think it's gone up to almost 19 to 20% now.
Mm-hmm.
And women are in slightly different military occupations in the military than men, but they are on the front lines and they are exposed to a lot of airborne hazards, chemical environment, toxins. as well as other things such as, physical injuries. And all of this is related and can be related into sleep problems, autoimmune, could be related to, things like psychiatric issues. So there's a lot of downstream things that are not directly connected, but may be connected. And it is, so our portfolio is quite large. Currently, we're focusing on specific things such as cancers, so reproductive cancers, breast cancer, uterine, ovarian. We also focus on menopause and menstrual cycle and reproductive problems such as endometriosis and, infertility. We are working on several databases and connecting with a lot of different VA and DoD databases to enlarge our numbers so that we can do epidemiological studies and find out the incidence and prevalence of certain things. We are also interested in things such as heart problems and also specifically things such as dementia, cognitive decline, and psychiatric issues. Because as you know, women have more, Alzheimer's disease is more prevalent in women, and so is depression. Depression is very high in women. Anxiety is higher in women. So we want to look at things not just by the numbers perspective, but also by the perspective of what is happening behind it in the brain, what's happening behind it in the body, such as what the mechanisms are, how the body is changing, how to do follow-ups, and how to provide not just better options for them, but also better treatment. And so, so it's an all-round thing that we're trying to do within the center.
Well, Dr. Jennings, how does this work from a clinical standpoint? Do you take data from other VA hospitals that are seeing women veterans, or is it just the ones that you work with out there, or how does the whole program work?
That's a good question, and I think so. We have kind of more the qualitative or more personal data that my clinical team acquires from actually having the privilege to be able to speak with these veterans and see them for multiple appointments, spend several hours with them when they're seen here. So we have kind of a detailed perspective that way and qualitative data from that source. We have an intake packet for our particular patients, which includes lots of questions on different exposures. I mean, you brought up jet fuels. We like to even get down to whether it's JP4, JP8, whether they worked on a fuel line, that kind of thing. And then, so we've had that intake packet for the War-Related Illness and Injury Study Center almost since its inception. But then we realized that there weren't that many questions dealing with reproductive cancers, fertility, things that affect women. So we created an addendum in the last couple of years to ask those questions in addition to our regular intake packet. So we have that data, which is extremely valuable. It's very, detailed and personalized, and we have information about their deployment, which theater they were in, what their MLS was. And then, but, the numbers there are smaller in a sense because it's so detailed. So Mithine's team, actually, we have, kind of an advantage of being located in Silicon Valley. We have a data architect. We have these, people that are great at crunching numbers. So they've actually gained access to really large databases that have, almost all veteran data. And we're working on that. Going back to jet fuel, we just had a paper come out in conjunction with our home office in DC about jet fuels and reproductive cancers. So for those type of data sets, we're looking at, large quantities of data. That poses its own challenges because, there's some medical data in one repository and then their deployment data in another. And so, I'm privileged to work with these really smart people that are able to, marry those databases and get those big quantitative numbers for us as well. So we kind of have, it's kind of a multi-pronged approach, I guess. It's a good question.
Mm-hmm. Well, is there a way for a woman veteran, say, in Louisiana. Is there a way for her to be part of your study, or is this all happen behind the scenes?
Yes, I think this is so. There are two types of studies that we really are. I can divide it into two. One is we look at databases and we look at numbers and we report things that exist, right? So we can do epidemiological studies and tell you what the incidence is of a certain type of disease in women veterans. For that, we don't need women to come in. We just need to access all these databases, and we have a lot of expertise in that and continue to grow that expertise. The other type of studies that I was talking about is we are really big into neuroimaging. We image the brain, we collect blood, we collect saliva, we collect how you perform on cognitive tasks. We are very big on collecting how these exposure measures, which is basically intake packet that we have, in which we, Dr. Jennings' team clinically has created a woman's questionnaire that specifically asks for how your health problems are based on the exposures that you've gone through. So for that, we need our women veterans to be extremely excited about this and to work with us and either work with us virtually or work and come in for research studies. So we're constantly looking to expand our horizons, tell people about what we do so that women are interested. And to be honest, most of the women patients Dr. Jennings have seen, they have all been really interested in this. So we work nationally. We're a national center. If someone is interested in our study and they find out through a flyer or through another VA or through they are welcome to come and be part of it. And we either work with them virtually or we try to bring them in, depending on what the study is. Some of our studies take days because we are working on collecting blood and collecting MRI, talking to you about your reproductive issues. And so there's a lot of, like, there's a lot of studies that we even can bring you in and we can, put you up in a hotel and pay for your travel based on the study that we are conducting.
Okay.
So yes, there's a lot of stuff out there. Yeah.
Okay. And would the process involve like going through their VA primary care?
That's a clinical question. I would let Dr. Jennings, because there's two different things. If they want to see us clinically, that's Dr. Jennings, and it'll go through their provider. And if it's research, they'll just come to us and we'll work directly with them for research. Correct, Jen?
Yes. So the clinical program is part of the national risk program.
Okay.
So we are divided geographically. We're out in California. We cover kind of the Western U.S. and then DC and New Jersey cover the remainder of the United States. So men or women with these deployment-related concerns, they can ask their primary care provider to put in a consultation for the War-Related Illness and Injury Study Center, and they're automatically sent to catchment area. So they may naturally go to DC, but I'm in constant contact with the clinical directors of DC and New Jersey. So if there is a woman that has specific concerns, they'll reach out to me if they get that consult. But as Dr. Adamson said, once we have these studies up and running, and we'll include a link to our website, we should have the contact numbers for those specific studies online that they can reach out to directly.
And is that the warrelatedillness.va.gov webpage?
Yes, I believe it's the War-Related Illness and Injury Study Center webpage, and then you can navigate to the Women's Center through that, or we can attach it direct.
You search us in Google, you just put in Women COE, we come up as Women COE, but we're a tab within the War-Related Illness and Injury Study Center.
Well, listeners, I'll have a link to the webpage in our show notes, so there'll be a shortcut there for you. Don't worry about that. Dr. Jennings, one of the biggest problems that women veterans have is that when they separate and complete their service, it's hard for them to, I think, want to be veterans in the sense that they don't act the same way as men do, and they're not wearing hats. They're not joining organizations like the VFW, the American Legion. About 65% of women veterans don't seek help from the VA. What would you say to them as a doctor for the VA and who sees women veterans all the time about why they should come and get treatment from the VA, or at a minimum get into the system?
Right. That's a great point, and we really welcome women veterans. And I have to say, when I was in medical school, in the late 1900s, we really didn't see that many women, and I could see why it wouldn't be their first place to go for healthcare, if we didn't have as many services for women as we do now. I do think that we've come a long way in really recognizing issues particular to women at the VA. There's pelvic floor therapy. There's a lot of research going on. A lot of our providers are actually women veterans. I serve on the clinical practice guideline group for menopause recommendations with, we have some active duty service members, some veterans. And so those recommendations will be coming out later this year, but there really is more of a focus on women. And especially speaking of menopause, a lot of times that transition from active duty to being a veteran comes at the same time as, menopause as well. And so we really don't want to lose these women to follow up, and we want to have them to have a good transition to care. And I think what Bill neglected to mention that are both the risk and the women's COE have three components, which is clinical research and education. And so we do have this large education component, reaching out to providers in the VA, really spreading the word about issues specific to women veterans. And we've tried to tailor our research and clinical programs as well to the fact that a lot of these women are, maybe part of the reason they don't engage in some of these groups is that they are, primary caretakers when they come home. And so, we're working to be able to for them to have labs being able to be drawn at their home or video visits, so they can work and be caretakers and get the medical care that they should be getting.
Wow.
But they are entitled to benefits, especially with the Tax Act. I encourage, veterans to at least, even if they have private insurance on the outside, I think it's valuable to be engaged with the VA.
Yeah, I think all veterans should register with the VA and make a claim. Women veterans are no different. They suffer the same illnesses and injuries that male veterans do. It's the same thing for women veterans as it is for guys. I tell them, look, it may not hurt you now, but I guarantee you when you get to be my age, it will. And then you'll get, a rating and some compensation. So get in there, make the claim now, and get registered. Be part of this research and this program, because it's going to benefit your fellow service members and fellow veterans. The research that they do it's amazing.
I think we're seeing a lot of Gulf War era veterans now, and I think by nature, they tough it out for as long as they can. Mm-hmm. And then, as they get older, they do come in, and that's what's valuable about working with the veterans. They are always willing to contribute to research. And I've heard time and time again, I don't know if you can help me, but if what I can contribute can help somebody else, then it's worth it.
Yeah, for sure. So as we wrap up, I just want to ask you both the same question. Dr. Adamson, when you think about the work that you're doing, how do you think AI will affect what you're doing?
Oh my goodness. Yes, it affects it very, very big. I think I was talking to somebody who is really focused on the predictability of human behavior. Mm. So, and I'll just give you an example. This is from an NIH study, and they actually wanted to find out how people are performing and how it has to do with what's called adherence to medication. That is a huge problem. A lot of people don't adhere to medication. And so they wanted to build these models so that they could figure out, are there any indications in their social media behavior that can predict that they will actually not adhere to the medication or give up the medication. And they were able to get permission to look at data from social media data, like what are they posting about themselves? And that actually predicted their behavior of letting go of their medication or something like that. So there's a lot of data mining that AI can do that can really help us do an incredible amount of disease identification, progression, as well as treatment. So that's huge. Of course, using it for avatars and helping people with coming into the clinic, making them do specific questionnaires, and all of that with the AI bots and stuff. That's great. But there's a higher purpose for AI, which I just explained with the study. So I think there are things like that I would really like to do, or like the way we map the menstrual cycle now with even an Apple Watch. It is so much more. It gives you so much more data than we have ever known about a woman's body. And a woman's body changes a lot. And it changes a lot, not just in the body, it changes, it not just in like organs that are reproductive, it changes everywhere. It changes the brain at a certain time of the menstrual cycle. So it's really important to use AI as a tool. And I think it's really important to embrace it in the hospital, in the home, but also it's a beast. So you have to control it. You have to be able to double check it and make sure that it is telling you the right information. And one of the ways to double check is that what data is going in it. Because what you have to make sure that there's enough information about women veterans, about exposures, about everything, so that it can calculate on the right amount of variables. If the variables don't exist, then that's not going to be able to give you the output.
I will pose the same question to you, Dr. Jennings, on the clinical side. Do you see any impact from AI?
I think it seems to be an inevitability in a way. So, I really approach it as using it potentially as a tool. I mean, like Dr. Adamson said, we are able to process large amounts of data using it, but recognizing that it is a tool and that, I still need to use my clinical judgment and want to review everything. I also am very protective of the women's data that we gather. There are all these protections in place, but, I feel like, there's a certain amount of trust in us as providers, and we want to respect that. So, I guess I approach it cautiously. I think it is, there's no other way to process sometimes these large amounts of data, but to be very, to have a lot of supervision.
All right. Well, listeners, again, it's the war-related illness.va.gov webpage, and I'm going to have a link to it in the show notes. I want everybody to go and check it out, see the resources, see the research that they're doing on all sorts of military exposure. And this is the VA at work. And again, I want to go back to not only women, but all veterans. You need to register with the VA and put in a claim. And okay, you're not going to get a 0 rating, or you'll get no compensation, but you're going to get on the books. Another thing that helps with is that the more veterans that are registered and the VA is servicing, the more money it's going to require, and the more they're going to get from Congress, which means the more money that these amazing doctors have here to do this kind of research that's going to benefit all of our veterans. So please check out the webpage. Make sure you put in a claim with the VA. Doc, listen, I can't thank you enough for coming on, both of you, and telling us all about the center. The work that you guys do is amazing. As a veteran, we really thank you for everything that you do.
Thank you for having us on, and thank you to all the veterans for their service as well.
Thank you very much. And I'm very thankful to all the veterans. Thank you for having us on the show. And I do remember the Undersecretary of the VA saying that the enrollment in the VA has increased this year. So I hope that it keeps increasing.
That's good. We need everybody to be registered. So, listeners, we'll have another episode next Monday morning at 0500. If you have any questions or suggestions, you can reach us at podcast@willingwarriors.org. You can find us on all the major podcast platforms. We're on YouTube and Wreaths Across America Radio. So until then, thanks for listening.
The Welcome Home podcast is brought to you by Willing Warriors, a nonprofit organization serving active duty service members and veterans since 2012. To learn more, please visit our webpage at willingwarriors.org.